All right, guys. So, like I said, this is going to be your digestive pathology and our test review. Open the waiting room up if anybody wants to join us. And I'm going to share my screen so you can see me write stuff down. Bam. All right. So, just rolling through some digestive pathology. I'm going to start at, I'm going to go through the anatomy from top to bottom and hit some big pathological high points. Ha ha ha. All right, we'll start with the mouth. Pathology I want to talk about with the mouth is cold sores. Anybody know what causes cold sores? Herpes simplex type 1. Well, we'll talk about that. Okay. Herpes simplex type 1. Okay. I want to talk about some misconceptions that folks have for that word right there. Okay. And that's one of the first things that I want to talk about is this is a virus. It's a virus that is the major thing that causes cold sores in the mouth. Cold sores, ulcers, different people call them different things. Okay, cold sores, ulcers are pretty much the same thing. Depending on where they are in your mouth, you can call them different things. But from a pathology standpoint, whether that's on the outside of your lip or on the inside of your mouth, it is probably caused by herpes simplex type 1. Okay, so misconception I want to talk about. Vito's kind of already led me to that direction. If I did a test for herpes simplex type 1 in the general population, any guesses on what percentage I would come up with positive? 80? Around 80%. Okay. And usually, well, that's what I was about to say. Usually, can you contract herpes simplex type 1 as a child? Because, you know, you're cleaning something up, or you're sharing a drink with somebody, or you have something going on where a parent touches their face or something, picks up a pacifier and gives it to the kid, things like that. Most of the time, herpes simplex type 1 is going to be contracted during childhood. And most of us are positive for it, okay? Most of the population would test positive for herpes simplex type 1. Also for most of us, it is relatively a mild situation. You know, as Wesley already mentioned, anytime your personal immune system is compromised, this can cause an outbreak. So if you get stressed out, if you're sick, if you are doing strenuous physical activity where you're putting your body to the limits, this is where you're more likely to have an outbreak. Okay, so you can go for months or years and test positive for herpes simplex type 1 and never have a cold sore or an ulcer. You go your whole life with it if you know your immune system is really clicking on the right gears. Now, this is herpes simplex type 1, which we must mention herpes simplex type 2 because, you know, it's the same name except for 2 different strains. Herpes simplex type 2, a little bit different because what we're talking about. Not warts, okay? It causes sores in the genital region, okay? So it's the same exact virus, a little bit different strain. It's more likely to attack the other mucosa on your body, your glands of your penis or the vulva around the vagina, okay? Now, a couple things we need to understand. Is it possible to contract herpes simplex type 1 in the genital area? Yes. But, here's but, stick with me. It's very unlikely. It's very rare because this virus is not attuned to that mucosa. Flip side of that, is it possible to contract herpes simplex type 2 in your mouth? Yep. Yes, but it's very, very rare. Okay, so one of the questions that I often get asked when we're talking about this is, well, if I have herpes in my mouth, should I be concerned about transmitting it to someone's genital region through oral sex? And the answer is, since it is very, very uncommon to have one type of herpes go to another place, the answer is no. There are other things you could be concerned about. Is more likely to contract HPV orally than it is to contract herpes orally. Human papillomavirus. We'll talk more about that when we do reproductive system. There has been, you know, how HPV does have a correlation with cervical cancer. There has been some studies that show HPV contracted through oral sex can lead to throat cancer. So that's just kind of some things to think about. But once again, the reason I wanted to talk about misconceptions is if you're talking about herpes simplex type 2, it's not exactly 80%, but it's also not 0%. Any guesses? The general population percentage for herpes simplex type 2? 35. Around 20. Okay, 35, it gets up into 25, 30% range in a more sexually active population. Like you go to a college campus, you're looking at 25, 30%. Okay, but here's the deal though. Here's the deal. Just like this is relatively asymptomatic and relatively mild when it is symptomatic, herpes simplex type 2 is pretty much the same. You can suppress it with medications like Valtrex, but it's still, this is not something that's going to make you be incredibly in pain. It's not something that's going to make you sterile if you get genital herpes. It's not something that is going to really change your lifestyle. You know, there are lots of things to be, one of the things, and this goes back to my problems with sexual education in high school and the whole, you know, let me scare you away from having sex idea. You know, we say, oh, you'll get STDs, you'll get STDs, you'll get STDs, and your life will be ruined. This is not an end of the world sexually transmitted infection. Is it something you'll have for the rest of your life? Yes. Is it something that's going to really affect your life? Probably not. Just throwing that out there. Okay. So herpes simplex type 1, not transmitted through oral sex in very, very, very rare situations. Very, very common, around 80%, and we're talking about cold sores caused by a virus. Okay, proof that herpes really isn't that big a deal. If it was, what would we do about it that we do with other viruses? Create a vaccine. We create a vaccine. And this is not a super virus. It would be easy to make a vaccine against herpes, it's just not worth it. Y'all with me? All right, carrying on. All right, so we go past the mouth and we talked about herpes. Let's go on down to the stomach. One of the problems that happen in the stomach is, and the reason I didn't use the word ulcer when I'm talking about herpes is because ulcers from an anatomy viewpoint is really talking about open sores, open wounds in your stomach or in your beginning of your small intestine. And the most common cause for gastritis or peptic ulcers. This is one thing that also people are like, well, you get ulcers because you get stressed out. You get ulcers because you eat spicy foods. Most common reason to get ulcers is because you have a bacterial infection from something called Helicobacter pylori. And that is a scientific name, so thus the underlining. Helicobacter pylori is a bacteria that can infect your digestive system and makes you much more likely to contract both gastric and peptic ulcers. Gastric ulcers, obviously going to be ulcers in your stomach. Peptic ulcers would be ulcers in your duodenum, the beginning of your small intestine. Okay. You have this bacteria. It causes your body, the bacteria will actually attack those goblet cells. You attack your goblet cells. What are you creating less of? That mucus, have less protection. The acid gets to hit the walls of your stomach or the walls of your intestine a whole lot more, and it starts destroying it. And you get this positive feedback loop where the more cells you destroyed, the less mucus you make, the more cells that are going to get destroyed. And so you can have some people with some really bad outcomes that end up with gastric and peptic ulcers, have all kinds of pain, have all kinds of problems eating certain foods. And sometimes it can actually be surgical. But the easiest way to do this is a bacteria. What can we do? Take antibiotics. Absolutely. If you catch this early, give the patient antibiotics to clear out this H. pylori, you can actually save them from having all kinds of problems a little bit later on.
So is it a different, so the bacteria that, well, it's not a bacteria that causes ulcers and often stuff, right?
See, that's why, like I said, that's why I didn't use the word ulcer up here. We use the word ulcer for both things because it's an ulceration. It's where you should have the skin looks like that. The skin instead looks like that. An ulceration, a spot where cells have been destroyed and you end up with this circular crater around where the cells have been destroyed. So ulceration is more of a structural term. And it's when you talk to in the medical profession or you talk to anatomists, a lot of times when they say ulcers, they're talking about the stomach. In common language, ulcers are used more to talk about in your mouth. And so that's why I'm careful with my terminology there. Structurally, yes, it's the same thing. Functionally, they're two very, very different things. Okay? Rock and roll? All right. Rolling on. Oh, I skipped one. Sorry. I said I was going in order and I skipped one. So I skipped one. What's between the mouth and the stomach? Well, pharynx. And then what about after that? Very good. All right. Some esophagus pathology that I skipped. I didn't mean to skip. And that is a gastroesophageal, no wait, that's the tracheoesophageal fistula. All right, tracheoesophageal fistula is a connection where there should not be a connection. All right, show you a picture of what I'm talking about. What do you call a sagittal section? Back off a little bit. All right, here we go. That's a good picture. Come on, baby. There we go. All right, so I got a sagittal section, which is right down the middle of someone's head. So you have your nasal area, you have your mouth. This big old thing right here, what is that? Tongue. Yep. Tongue looks way different inside than it does outside. You'll see that in the cat. So this is where I want to talk about, of course, right where the little watermark is. All right, when you swallow, what's going to happen is this is your epiglottis. You'll see the epiglottis in the cat as well. When you swallow, this epiglottis is going to smack shut and the food goes down the esophagus where it belongs. When you're not swallowing and you're breathing, the air is allowed to go down the trachea. A tracheoesophageal fistula is a connection where there should not be one. So you mix up your food, your water, and your air. This is a congenital defect, which means what? You're born with it. This is a congenital communication between the trachea and the esophagus. Yep. Now, you're not just going to be eating because you're not, this is, when are you going to find this? Yeah. So you got a baby that every time it tries to eat or nurse, it refuses or it starts coughing and gagging. It can be a really emotionally straining situation because the nursing process is such a a delicate process anyway, where you're connecting this new child with the mother and things like that. And to have, you know, one of our first interactions be this negative, like every time I try to nurse you, you cry and cough and gag, that can be really detrimental. And you know, years ago, it would have been a big problem, probably caused death in an infant. Today, it's a pretty easy surgical fix, but it is something that happens and something that's pretty easy to check out and see coming up. Cool? All right. So rolling on, we already did the stomach. We're gonna roll down to the intestines. If I can find my spot. There we go. Yeah, so small intestine and then large intestine. Small intestine, I want to talk about, if I can find it. Where's it at? There it is. So I dealt with a congenital defect, we have a bacterial infection, and we have a viral infection. This next one is a disorder of unknown etiology. What does that mean?
You don't know what it's called.
Yeah, no idea where it comes from. They're still working on that, but it's a chronic inflammatory condition of the intestine. We'll talk about Crohn's disease. Named after, I guess, Dr. Crohn, who discovered it. But Crohn's disease is a chronic inflammatory condition of the intestine. And when I say intestine, I mean small intestine, so we'll say that. So we're talking the jejunum, the duodenum, and the ileum. And what happens is you end up with a cobblestone appearance. Instead of, you know, a nice smooth little up and down of your intestine, you end up with this cobblestone looking intestine. All right, and that really impedes your absorption and causes you to have all kinds of digestive issues with bowels and lower digestive problems because you're not absorbing the things you need to absorb. And so your feces ends up with a lot of things with nutrients in it and can be a really uncomfortable way to live your life. I already mentioned this is of unknown etiology. More common in men, and most of the time it's going to present in men when they're young. So men in their 20s. Most common presentation is young men in their 20s. It can present later, but it most commonly presents when men are young in adulthood, and it's definitely more common in men. Where it's coming from, people really don't know. My personal connection with Crohn's disease is David Garrard. You guys might be too young for David Garrard, but David Garrard was ECU football player, and he was one of our last really good quarterbacks with respect to the folks that have played recently. But when I was in college, David Garrard was in my physics class, and so I was like, ooh, you're a football player. He went and played for the Jaguars. It was great. I played for a couple of NFL teams. But when he got drafted, you guys know enough about football that when you go to the combine and when you get drafted, what are they going to do? As far as, and when they do a physical, it's not like your sports physical for high school and not even like your sports physical for college. When we're investing millions of dollars into you, we're going to find out everything. And when he did his sports physical for the Jacksonville Jaguars, they found out he had Crohn's disease. And he was already dealing with some of the symptoms, but he got medicated. He missed about a season where he was getting his body right and dealing with it, taking medications to deal with the symptoms, no way to really get rid of it. And he ended up starting for like 3 years for Jaguars. But pretty cool little deal. What? What'd you say? David Garrard. He was quarterback for the Jaguars before Byron Leftwich. Byron, yeah, I think, yeah. Well, he was David. I think David's last year was Chris Johnson's first year. I think. No, yeah, because David Garrard was with Steve Logan, Chris Johnson came with John Thompson, and so I want to say that they didn't have much overlap, because Chris Johnson was like when I was in medical school. David Garrard was when I was in college. But yeah, so Crohn's disease, chronic inflammatory disease, it happens. It's relatively common. And, why it happens is kind of a mystery. All right. Rolling on, the last thing I want to talk about is what we've already talked about, and that's Vibrio cholerae. That is the bacteria that is going to cause what disease? You kind of see it up there, cholera. And this bacteria is going to attack and shut down your large intestine. Bacteria attacks and shuts down the colon, which causes what major problem? Diarrhea. That's true, it causes that, but that's not the problem in your body. The problem in your body is dehydration. Major dehydration. And it's dehydration that you cannot keep up with. They have these things called cholera cots, where a cholera cot is just a cot, fabric cot that you lay down on with a hole cut in where your butt is. And the idea there is you put a pan so the person doesn't have to get up and use the bathroom, and you measure the liquid that comes out of them, and you do your best to replace the liquid back into them. Eventually, you can't keep up. Eventually, the person cannot drink fast enough to keep up with the fluid that they're losing. And so that's where you end up by death by dehydration. It is a bacteria, which means today it's not quite as big of a problem, because what can you do? Take some pretty hefty antibiotics pretty quickly to knock it out. But you go back 150, 200 years, that's probably the number one. If you look at it, really, the history of humans, Vibrio cholerae, that bacteria has probably killed more humans than any other one thing in the history of humans. Now, today it doesn't kill as much because we drink healthy drinking water, and we have bacteria, we have antibiotics, but in some parts of the world, you still have to worry about contracting cholera. Rock and roll? All right. So that's the new stuff for today. Everything else is just stuff we've already done. So we're going through this real quick for review so we can have folks at home. I got multiple choice questions on everything I just talked about. It's pretty straightforward there. What do you call the enzyme in the mouth that begins chemical digestion? Something ACE. Every answer is ACE. Anybody remember? It does. Looks like a girl's name. Amylase. Okay. Amylase. What do you call chewing? What do you call chewing? What's the process? Mastication. Okay. What about swallowing? Deglutition. Deglutition. D-E-G-L-U-T-I-T-I-O-N. Deglutition. All right. We got a piece of, I just ate my hamburger. So hamburger in my hand is hamburger. As soon as I put that hamburger in my mouth, what is it? Bolus. I swallow it. It goes down my esophagus into my stomach, and my stomach turns it into chyme. C-H-Y-M-E. Chyme. I didn't mention the flexures yesterday. Make sure we got our flexures. We go mouth, esophagus, stomach, duodenum, jejunum, ileum. Down here at the corner, we have the cecum, different color. Cecum, what colon? What's another word for going up? Ascending colon. Now, this is what I didn't mention yesterday. Ascending colon, transverse colon, descending colon, sigmoid colon. Okay? There's two things I didn't mention yesterday are this and this. Okay? This turn is named for what's right beside it. What organ is right here? Right upper quadrant of your abdomen. Liver. This is the hepatic flexure. This one over here is named for the organ on the other side. I think you said it. Nah, pancreas goes kind of across. We hadn't talked about it's not a digestive organ. Spleen. This is the splenic flexure. And sometimes the sigmoid colon is actually called the sigmoid flexure as well, but we already talked about that. Okay, so hepatic flexure on liver side, splenic flexure on the spleen side. Functional things. Where does digestion begin? What's the very first part? Digestion. Very good. What part of your body you're going to have goblet cells that produce mucus? In your stomach. What's the most important part of your digestive system because it does the absorption? More specific. Three parts of your small intestine: duodenum, jejunum, ileum. Ileum. Okay. So ileum is where most of the stuff is going to be. You're going to get your water back where? In the large intestine. Give me a better word. I just told you, ascending, transverse, descending, colon. Okay. And then finally, I'm going to store feces before I get rid of it in your rectum. Okay. And then I need you to put everything in order. So we'll go through that really quick. We kind of did a little bit of it, but we'll go through it really quick. Mouth. Before you get to your esophagus, you told me earlier. What do you call your throat? You told me earlier. I did? Yeah. Before your trachea and your esophagus and after your mouth. A better word for your throat. Somebody told me earlier. Pharynx. Pharynx. So pharynx, esophagus. Esophagus leads into your stomach. Stomach's going to lead into your first branch of your small intestine, which is your. Say it loud. Duodenum. Duodenum, then the jejunum, then the ileum. Ileum is going to end at the bottom right corner, lower right quadrant of your abdomen at the cecum, and it's going to turn into the ascending colon, transverse colon, descending colon, sigmoid colon. After that was the large intestine. After the sigmoid colon, rectum, and then the anus. Rock and roll. It's a pretty easy test tomorrow. No essay. I just need you to put those things in order. So if you get it a little bit off in order, it's probably going to mark a bunch of them wrong. I'll try my best to try to give you credit for what you do put in order. But yeah. Rock and roll. No. Folks at home, enjoy. We'll turn this into a video real quick. Yeah.